now turn it over to Ed Safdie. Ed is someone who comes out of the healthcare sector. He's very knowledgeable in that sector, and he's actually developed, he's kind of followed along the path that we've laid out and started putting together some really important pieces of information about his sector. So Ed, take it away.
The group that's on the panel for this call and others started with a blank sheet of paper. And we had several robust working sessions to develop the potential questions to ask for a SALS, a sector asset leadership structure. We put them into groups, and I briefly want to go through them here. After going through them here for 10,000 foot level, we're going to skip into the actual SALS paper for healthcare infrastructure and show you what the first sample of a SALS looks like. So here we go. First, we want to define the sector, just exactly what is it that we're going to address. And I'm going to say this again when we get to the paper, but it's really important to define the sector and what assets are included in the sector. And I'll explain why that's important when we get to the paper. What is the current state of your sector? If you're familiar with the American Society of Civil Engineers, I believe our grade for the national infrastructure, which has, I think, 19 or so categories, went from a D+ to a C-. There are issues to be addressed, and you will see that all the sectors can and do affect the healthcare infrastructure sector. And by that, I mean real property, the actual physical infrastructure for healthcare. What are the boundaries? What regulations are involved? For those of you who've worked in healthcare, you heard of TJC, and that's something that we all have to comply with, even though it's voluntary, or the entity in question won't be able to receive third-party funding. But that's just the beginning. You will see when we get to the paper that there are manifold regulations, laws, and other best practices that are not required to follow. The sector objectives, well, what is it that we're trying to accomplish? Safe roads, clean water, exactly what are we trying to accomplish? And what are the categories of assets within the sector that are going to be included in our SALS? Can we go to the next slide, John? This one's, excuse me, this one's really important, the stakeholders. I do recall that we had long discussions about stakeholders, and that influencers, as Jack mentioned, are one of the components of stakeholder. Absolutely critical, because the influencers can change the working lives of those who try to manage assets in the infrastructure. And here it becomes critically important for advocacy. That is something where the ALN is heavily engaged. And what are the objectives? What are we trying to accomplish? Let's define it. For those familiar with A55K, with ISO 55001, metrics are important, and it's important that they're achievable. What management systems are going to be put into place to manage the sector, the assets in the sector? And here's another one. A cold light of morning look at what obstacles are in the way to achieve the objectives that have been defined. And for compliance, how or will the sector or the organization building an asset management system comply or choose to comply with A55K? And what are the benefits? You've heard part of that in the earlier portions of our presentation. So that's a big picture, a 10,000 look, a view look at the the questions we developed. And John, if you could bring up the paper. You see the date there. We developed this in November of 2020, and you can't see it yet, but it's already changed. It's being improved, and I would like to say on the first round, principally from lots of excellent comments from Jack Kelly, who's also on this call. Jack read everything that I wrote and came back with feedback. So we're going to try to implement most of those in the next round. And can I just say, I joined Grant Thornton 2 years ago, almost 2 years ago, and Moshe quickly introduced me to the ALN as soon as I got here. I came here after a career in engineering of almost 4 decades working in healthcare. So I developed this paper from the lens of someone who started in the bowels of the medical center, maintaining systems and equipment up to the executive suite. So while I had a full picture, a full spectrum view of healthcare infrastructure, I'm just one person. This is just a draft, and we need other SMEs to contribute. We welcome feedback at any time, and you can contact any of us to do so. We look forward to that. So I want to emphasize this is just a beginning. And we can scroll down to, I've mentioned that the content is dynamic. We can scroll down to page 2, John, where the titles are Pressing Problems and Strengths. Here we go. I'd like to talk a little bit about pressing problems right there in the infrastructure. It's aged. The aged infrastructure might apply more to some entities than others, but it's aged. And as we all know, and especially Jack knows, having worked in OMB, it is a challenge, if not a fight, to get adequate funding for sustainment, for recapitalization, for maintenance and repair. So it is a huge challenge in the field for those of us that have been on the front line where the delivery of healthcare takes place. Just one example, the electrical grid infrastructure in the nation is not in great shape, and that has a direct effect on the management and efficacy of providing healthcare in medical centers. They have to be prepared. They have to be prepared, and they have to be prepared with potable water as well. I've experienced both of those in the field, from earthquakes and hurricanes. You just don't know when it's going to go down, and you have to be ready. Inadequate capital funding, that's another huge challenge. We have to plan ahead, we have to make realistic goals, and we have to prioritize. So this is a constant challenge for those of us working in the field to get these things done. And rapid technological improvements. In the last decade, I would say, it's become a much bigger challenge hiring qualified staff to maintain facilities. The advent of first microprocessors and then far more advanced computing systems means that they're great. They help us get our work done, but it means that it requires special training to maintain them. That goes for building systems, patient record management, et cetera. In this case, it's the building systems that we're concerned with. I found that toward the end of my career, we were doing a lot more contracted support and unable to hire the staff that we needed for varying reasons. But there was a lot more contracted support. And you can scroll down just a little bit, John. What are the strengths of the sectors? And despite these challenges, I have seen through those decades of work that the leaders and staff who work out there are dedicated. That is a main strength. In fact, I'd go so far to say as it's a mainstay. One side discussion that we've been having is something that some of us would advocate for, and that is for the ASCE to start giving a grade to the healthcare infrastructure. This is where we care for our most vulnerable citizens and others, and I believe it merits consideration. Looking at that next sector, the ASCE score for infrastructure, if you could scroll down just a little bit, John. Yes, too much. Thank you. There are campuses like, say, a Stanford or a UCLA where there are healthcare facilities in a campus. They're miniature cities. There are many that come to mind in the Department of Veterans Affairs where I worked, like in Hines or Palo Alto or Los Angeles. These are miniature cities. If the overall grade for the infrastructure is a D+ or a C-, and all those sectors can affect the healthcare facility infrastructure, we need to pay attention to all of that. There are manifold reports that are out there that highlight these challenges. The average grid circuit is 40 years old, some cases as old as 100. There's no real-time monitoring. The controls for them are written in a language from the 1950s. The picture becomes clear. That is why we have to be so well prepared. Can we scroll down just a little bit, John? Oh, yes, the impact of electric vehicles on the grid for the nation as a whole is going to be substantial. It'll be the equivalent of a commercial building moving around and reconnecting to the grid, drawing power. Today, the average utility can collect 60 million annual data points for 5 million customers and a dozen annual bills. In the future, it may have to collect up to 5 billion data points. All these things can have a cascading effect on the healthcare infrastructure. Then we talk about laws and regulations. Just what laws and regulations impact the sector? So if you scroll down just a little bit, John, you're going to see a bunch of bullets there. I'd like to hold on that one about the Joint Commission. Can you scroll back up to the paragraph, please? Joint Commission is key. Those that haven't worked in healthcare may have never heard of it, and this was an interesting topic of discussion for our group as we developed this. As I said previously, while it's voluntary, passing the TJC is essential to achieving third-party accreditation for funding, for reimbursement. The revocation of accreditation is a disaster. And what does one have to do? What does the entity have to do to pass a Joint Commission survey, which occurs unannounced every 2 years? 250 standards across a spectrum of services in the medical center. So one quickly gets the idea of the challenge, and that's just the beginning. What about NFPA and all 99, 101, 70, all the codes comprised in the NFPA? Those each require experts to be able to comply. What about OSHA and the National Historic Preservation Act? And if we scroll down, John, there's a few more. I'm not going to name all of them, but NEPA, excuse me, NEPA and ANSI standards. A lot of the standards that you see that come after that apply to federal entities, but they have cascading effects on private industry as well. So there's so much to know, so much to learn to be able to comply and maintain the infrastructure. Could we go to page 3, John, where it says boundaries? Here we go. I mentioned those boundaries. The ones that you see in italics on the list of other sectors are the ones that can most deeply affect the healthcare infrastructure. I've already talked about those a little bit, so I'm not going to go into further detail. Suffice to say, the healthcare infrastructure is dependent upon and can be influenced by the other sectors. And page 5, John, like to skip to stakeholders. There we go. This topic brought about more robust discussion among our groups as we spoke together and built the list of all the stakeholders for the healthcare infrastructure. Take one look at that and see the expanse and how each stakeholder has a different effect or influence upon the healthcare infrastructure. It is a complex undertaking to advocate, to implement laws and regulations that are reasonable and that can be met, and to care for our patients, which is the cardinal goal for the infrastructure, to provide safe and efficacious healthcare. And I'll go down to the bottom, page 7, voluntary standards to close before turning it back to Jack. These are things that the healthcare infrastructure managers and leaders don't necessarily have to comply with, but are helpful. We've mentioned ISO 55000, less known as the 41001 standard for facility management. ISO 9001 for quality management is prevalent in healthcare industry now, especially in sterile processing. Construction Industry Institute, constant construction projects in a medical center, improving, adding, sustaining, modifying. There are all these professional standards and guides that need, well, I couldn't say need, but that the entities and the sector should become familiar with to perform at its peak. That's a picture of what a SALS looks like. I will close by saying this is just a beginning. We intend to improve on this as time goes forward, and we welcome your feedback at any time. Jack, it's all yours.
Thanks, Ed. And so Ed gave an excellent overview of just how complex these sector-based approaches are. There are just a lot of things you have to consider within that are unique to a sector that affect how you approach the influencers in that sector, and you help the influencers approach the asset owners and operators. And in some cases, you may just want to approach the asset owners and operators directly. So it is the kind of enterprise that requires very specialized knowledge. Ed brings that kind of knowledge from the healthcare sector, and he's intersected with a lot of the other sectors, like the water sector and the energy sector and so forth. But what we are looking to do is to build teams of people around experts like Ed in the different sectors that we want to engage in. We want those folks to help us understand the unique aspects of each of the sectors with which they're familiar, and to help us map a path forward on how we can be understanding of those unique aspects, and then figure out where the opportunities are, where the barriers are to actually mobilizing people to implement ISO 55000. One of the things I will say, and when I was listening to Ed, it sounds kind of overwhelming, all the things that people have to consider. The nice thing about ISO 55000 is it helps organizations set up management structures that consider them as just a matter of course.